Hi, my name is Alex Wünsche from Zahntechnique in Miami. And we all know the problem when we design restoration digitally. We may have areas that are too thin, or we don't even know if it's too if the design is good enough to not having a fracture or a stress break. So I was able to utilize a software called SimQ from Germany. And with that software, we actually can evaluate our designs if the designs are safe to mill or to print, to fabricate, basically, that they will not break or will not have any stress fractures.
Hey, I would like to show what made my life really easier over the last few weeks or months. We tried a new software called SimQ, and what we're doing here, we basically evaluating designs in terms of fracture or breakage risks. What you see here, I just imported the design and the models of a 300 bridge. That actually was a bridge which broke in the patient's mouth after a couple of weeks of wearing, and so we utilized SimQ to analyze the design. And what you see here now, we imported everything. Now it goes up to the cloud to SimQ for evaluation. And after the upload, we then have to wait a few minutes, and we see basically or see a download and a result. You see here it's running now. And then after it comes back and we can look at it, and we actually can see where we see some fracture risks or where might be is the problem on the bridge why it broke. So now we can go through different stages here, and the second stage you see here, that little orange area, that's exactly the area where the bridge broke actually. So that's the highest stress area here, what you see here in this kind of bluish greenish area. And again, that's exactly the same area where the bridge fractured and broke, and so we had to redo the bridge. So to redo it, we went back to the original design and then basically concentrated just on these areas what SimQ showed us where the bridge is maybe under stress or where there's a fracture risk, what basically is suggested to add some materials. So what I did here, I added materials lingually as well, but also especially facially where that fracture risk was. And also smooth it out a little bit better, so do not actually literally invite the bridge to break there. So recalculated the bridge, merged everything, and then sent it back or saved it and sent it back to SimQ. So I uploaded the same files, the corrected files on the same bridge basically, to SimQ, the same workflow as we saw before, and just drag and drop it pretty easily, very simple. And I will see here the design pops up, and I just check if everything is here, and then I click on run. So now the bridge gets basically uploaded to the cloud, to SimQ. It gets calculated and evaluated, and after a few minutes I can go back and I will see in SimQ in the software the result. And here we definitely can see now, wait a couple seconds until we see the result. It's running now here. That will take a few minutes. I'll speed it up for you guys. And now we can see here it's done, the result, and we can check the result. The bridge is going to be open now on the screen. Everything is browser based, which is really cool. You don't have to kind of go to software here. And now you see that design is filled up facially, and there's no stress area here anymore, right? Since it's light gray or so, that is totally fine. It doesn't mean we have to add in material. So the whole orange or reddish area are gone. So that's our new bridge. So after I evaluated that, I can now sleep again and can just send out the bridge to my client, and we should have not a fracture.